Well, according to experts, a delay in vaccine procurement on the African continent may result in apathy. Some health experts believe that with good publicity and continuous advocacy on the need to be vaccinated, the apathy can hopefully be resolved. Well, joining us in our Lagos studio, Professor Oyewale Tomori, a virologist, Chairman, Expert Review Committee on COVID-19. Thank you for joining us on the program.
It's my pleasure.
First, looking at the NCDC daily figures, is there still COVID-19 in Nigeria?
Yeah, definitely there is. The fact that we're even getting figures, if you look at the figures, it tells you only about 5 states reported. We don't really know whether the states are testing, because they never let us know how many states are testing and how many are positive. I think that is an additional information we need to know. Of the 37 states, X are testing, only 5 are positive. That's what we call full information. And it's on the basis of that you can decide, properly evaluate what the situation is. But the fact that we're picking some of these cases, it means it's around.
So that's also a big problem, that we don't know about the tests states are conducting.
Yeah, you're right.
Looking at the variants, which appears to be a problem around the world, there appears to be controversy over the Nigerian variant somewhere in the United Kingdom. Fears spreading that it might be worse than the South African variant and the Brazil variant combined. Is there such a thing?
I think the first thing to say is that there's no Nigerian variant. If you check the times, this variant B1525, whatever you call it, it was found almost about the same time in Angola, in Nigeria, and in the UK. It's true that the cases they found in the UK were from Nigerian travelers. But the fact that you found it a day before in Angola and then this following day in Nigeria does not make it a Nigerian variant. Unfortunately, we got that tag and we had to keep by it. So it was occurring in different parts of the world. It is how fast you test that determines where you determine it. And whoever gets it first, unfortunately, gets the name. So really, and what has happened in Britain is that they don't have a proof yet of what it is. It's a speculation. It may. That's what you hear. You go and look at the thing and say, it looks like, because they're detecting more of it, because they're testing more. And it's a matter of the same situation we have in this country. The more we test, the more we find out. I mean, the variants we are finding in the country, our testing has not been what it should be. We think it should be better than what it is, but it's not. And that's why we have these gaps, and that they will not let us be able to predict or analyze and interpret effectively.
So essentially, we can't say we have a database of variants that we're seeing in the country.
We have, but it's not complete. That's the problem. If you notice, the first time we actually detected some variants in this country was sometime in December last year. But these were samples collected in August. So that gap, I mean, what you should be doing is, as soon as it is possible, get this testing done real time. And one of the things we had advised that on a regular basis, each of the labs that are testing the country, both positive and negative, on a daily, weekly basis, they should get these samples to the sequencing centers. And the earlier we do that, and what it requires is get the proper organization, or funding to get these labs to transport this. There are about 4 or 5 laboratories that are sequencing in the country, and we need to get the remaining labs over a properly synchronized system where on a weekly basis we get these samples to those sequencing labs. That's the only way we can provide answer. Or otherwise, we'll just be speculating on incomplete data.
In view of our vaccination plans and where we are, a slow rollout across Africa, we have countries like the UK putting India, that's going through a lot now, on the red list. Should we be thinking of doing something similar in terms of travel?
Yeah, I mean, the example of India is something that we should all learn from. India was doing very well. Then they relaxed a little bit of relaxation. Have this Hindu festival and all those kind of things. They relaxed that, and boom, the thing came up. We're waiting for the next festival to occur in Nigeria. I believe we were not taking, because we have abandoned all the non-pharmaceutical diseases. A big celebration or whatever in this country could set us back into the 3rd wave. We had a short period from about August ending last year, and then suddenly in December, coming with the Christmas, then we had a wave. I don't know what next ceremony we're going to have that will bring more people into the country. So we're having a lull now, but with the situation that is going on around the country, a lot of people not wearing their face mask, pharmaceutical and all this safe distancing not taking place, I think we are setting ourselves up for possibly a 3rd wave that is coming.
part of the restriction is the issue of the COVID-19 vaccine passports, which, a lot of the richer countries are looking at, starting pilots, UK, in the summer. What's your take on that, having a vaccine pass?
Well, okay. I think, first of all, the word vaccine passport, I think, is a misnomer. This is not the first time we're having vaccination being used for travel. You don't remember the yellow card? This will be called yellow card for yellow fever, maybe cholera, stamp or something. I don't know why they end up with the world using passport for this one. And I think it is totally unfair. Why is it? Because vaccines are not available in many places. So you cannot begin to put a law in when there's no availability of vaccines. If the vaccine was available to everybody, of course, then nobody will complain. But right now, we don't have the vaccine, and you say, I can't come in because of that. Well, it worked with yellow fever because, the vaccines were available. You could get it anywhere you wanted it. So, but then they were not even calling this yellow passport or whatever. So I think we should stick to the fact that this is a card that contains your vaccination history. That's it. That's the way I look at it.
Let's look at the numbers that have been vaccinated in Nigeria, 1.1 million so far, over that number. And this is the first dose that we know of. For those who might not get the second dose, what happens to the efficacy of the first dose? And what is the efficacy of a Oxford-AstraZeneca vaccine?
Well, first of all, let me look at the word efficacy. We can't compare efficacy of the one that one has 90%, one has 60%, when you did not test them under the same condition. I think that's one of the problems. I think when people say somebody has 90%, you tested 90% in Europe. This guy tested his own in Brazil. The other one tested in South Africa. So we have different things. So we don't compare things like that, So right now, you can only say it's efficacious for the place where you tested it. And therefore, so that's the first thing. All WHO requires is have at least 50% efficacy. And that makes it as good as any other thing. Now, getting the first dose only ups your immunity up to a level. The second dose boosts it up. But then there's also that gap in between. I mean, normally when you get the vaccination, it will take you another 10 to 14 days before you actually develop immunity. So it's not the day you get the vaccine that your immunity comes up. But then you get that second dose. And sometimes the long interval between it also helps the body, to boost up the immunity. You remember with polio vaccination that we used to give our children regularly. Some also yellow fever. WHO comes back every 10 years. So there's no real fast rule about in between when you should do it. I mean, you remember Britain turned it to 12 weeks, or the manufacturer said do it in 21 to 28 days. So it doesn't really matter. The important thing is that first dose doesn't give you the level of immunity that you require. The second one boosts it up to a level that can say, I'm fully immunized. So if our people don't get the second dose, they will be protected, but not to the level that one is comfortable with. Therefore, we need that second dose to give it that full immunity to our people.
All right. We'd like to thank you for joining us on the program. Professor Iwale Tomori, Virologist, Chairman, Expert Review Committee on COVID-19. Thank you once again.
It's my pleasure. Thank you, Millicent.